Welcome, ladies and gentlemen. My name is Refferty. With the last candidate on my student ID 003, and in this student project from SCDP2, we are going to talk about a topic from Hematologic System and Disorder and Clinical Oncology, Acute Myeloid Leukemia. Next slide. Here are the list of group members from SCDP2. Next slide.
Dian and my last digit of my student ID 070 and I'll continue the presentation. So the malignancy of myeloid lineage stem cell precursors is called acute myeloid leukemia or AML, which is caused by changes in genetics that lead to neoplastic changes and clonal proliferation. AML is one of the leukemia disease whose case is rare. Even so, AML has become a major cause of cancer-caused death. Increasingly, advanced treatment may help in younger patients, but prognosis in new cases of older patients is very bad. Recent population of the study shows a 5-year survival rate of 15% for patients of variant ages. Therefore, in order to understand acute myeloid leukemia better, we will go deeper to epidemiology, etiology, risk factors, pathophysiology, clinical manifestation, complication, diagnosis, staging, differential diagnosis, prognosis, prevention, and treatment in this study. The next one is problem formation. What are the epidemiology, etiology, risk factors, pathophysiology, clinical manifestations, complication, diagnosis, staging, differential diagnosis, prognosis, as well as prevention and treatment of acute neoplastic leukemia. And then the objectives are to inform about the epidemiology, risk factors, etiology, pathophysiology, clinical manifestation, complication, diagnosis, staging, differential diagnosis, prognosis, as well as prevention and treatment of acute neoplastic leukemia. And the last one is benefits. We hope that through this literature, society will gain further insight into acute myeloid leukemia. We also hope that this literature can widen the knowledge of healthcare association regarding this matter. The next presentation will be continued by my friend.
My name is Sasi Kirana and the last three digits of my survey numbers are 212. I will begin my explanation with epidemiology. Acute myeloid leukemia is a rare disease. Males are 1.2 to 1.6 times more likely to develop AML, with an age-adjusted incidence of 4.3 per 100,000 per year in the US, UK, Canada, Australia, and Sweden, and a median age of 68 years in the UK. A study at Ciptomangunkusumo Hospital in Indonesia found leukemia as the most common childhood disease with 30 to 40% prevalence. Acute leukemia with 78 prevalence under the age of 50 is also increasing globally. That's all from me. Thank
Now we
you.
will discuss about the etiology and risk factors of AML. Now we will discuss about the etiology and risk factors of AML. Firstly, my name is Ngurah Bagus Bhismaka Ariel Putra and my last 3-digit numbers are 1 to 4. The etiological factors of AML are quite diverse, ranging from gene mutation to chromosomal changes. These changes may cause myeloid stem cells to produce myeloblasts, abnormal and immature white blood cells, more than our body can tolerate, and causing the symptoms of leukemia. These mutations may appear higher in several people due to several risk factors. Here are some of the risk factors of AML, including the examples. People with genetic condition, for example Down syndrome, Fanconi anemia, and Bloom syndromes, may increase the risk of developing AML in their childhood age or adolescence. Second, people with blood and bone marrow disorder, for example myelofibrosis, myelodysplastic syndrome, and polycythemia vera. Third, family history of AML. For example, twins have greater risk of developing AML if one of them suffers from AML before 7 years old. Fourth is age. AML is higher in older people, especially those who are over 65 years old. Fifth is gender. AML is higher in male. Sixth is lifestyle. For example, smoking tobacco and alcohol consumption, especially in pregnant women, may cause higher risk of AML in their children. Obesity and food consumption or diet are also the risk factors of AML. 7. Environmental factors including exposure of benzene, ionization radiation, chemotherapeutic agent, electromagnetic field, viral infection, and several other substances exposure.
Hello, Doctor and friend. My name is Amelia Hasikiana Dewi with last digit 207, and today I will explain about the pathophysiology of acute myeloid leukemia. The primary pathophysiology of AML is a maturity block or halt of the maturation process, which stop the differentiation of production of myeloid series cell in immature cell. Mutation in hematopoiesis-related genes are what define this. The mutation results in inactive erythropoiesis and bone marrow failure. Bone marrow failure syndrome results from an interruption of normal hematopoiesis caused by a build-up of blasts in bone marrow. Their immaturity prevents from being able to combat or prevent infection. Anemia, easy bleeding, and bruising can result from a bone marrow production insufficient red blood cell and platelets. That's all from me. Thank you.
Hello, my name is Skylenn Hertanto Tan with the last three digits of my student number is 145, and today I will explain about the clinical manifestations of AML or acute myeloblastic anemia. So the clinical manifestation of AML can vary widely, and recognizing its signs and symptoms is crucial for timely diagnosis and treatment. So one of the most primary clinical manifestations of AML is the manifestation of signs related to the bone marrow failure. So patients might experience symptoms due to a decrease in normal blood cell production, and this may include fatigue and weakness as AML can cause anemia, leading to fatigue and weakness due to shortage of red blood cells, which are responsible for carrying oxygen throughout the body. Then, AML can increase susceptibility to infections, as the reduction in mature white blood cells impair the body's ability to fight infections, making individuals more vulnerable to frequent infection. AML can also lead to a decrease in platelet, resulting in bleeding and bruising tendencies. This may present as frequent nosebleeds, easy bruising, or prolonged bleeding from small cuts. In AML, leukemic cells might accumulate in the bones and joints, causing pain and discomfort, especially in joints. And other clinical manifestations include the enlargement of lymph nodes, spleen, or liver as the leukemic cells accumulate. Some individuals may also experience a decrease in appetite, leading to unintended weight loss and shortness of breath with pale skin due to a reduced number of red blood cells. Additionally, in some cases, patients might exhibit specific symptoms related to the infiltration of leukemic cells into other parts of the body, causing neurological symptoms, skin involvement, or complications in specific organs. So in conclusion, the clinical manifestation of acute myeloblastic leukemia can vary from patient to patient, making it essential to be vigilant about any unusual and persistent symptoms. Early detection and proper management play a crucial role in improving the prognosis and outcomes for individuals affected by this aggressive form of leukemia. Maybe that's all from me. The next slide will be explained by my friend. Thank you.
Hello, my name is Bernard, with the last digit of my student number is 103. Now, I will talk about some of the complications associated with acute myeloid leukemia. First, there is infectious complication. Infectious complications are the main causes of death in people with acute leukemia. This can include fungal, viral, and bacterial infections. The second is febrile neutropenia, a common complication in patients with AML characterized by a fever and a low white blood cell count. The third is bone marrow suppression. AML can cause bone marrow suppression, leading to decreased production of healthy blood cells. Fourth is gingival or gum enlargement. Gum enlargement is rare but an early warning sign of AML, especially in cases of M2 AML. Fifth is tumor lysis syndrome. Tumor lysis syndrome, or TLS, is a life-threatening complication in patients which suffer from acute myeloid leukemia during chimeric antigen receptor, or CAR, T-cell therapy. The sixth is graft versus host disease, an AML complication because of allogeneic bone marrow transplantation. The seventh is infertility. Many treatments of cancer, such as chemotherapy and radiation therapy, can negatively affect reproduction cells in organs, which can lead to infertility. That is all. Thank you.
Greetings, my name is Putu Sri Dianingsih with last three digits of student ID 201, and now I'll explain the diagnosis of acute myeloid leukemia. So, AML diagnosis involves a comprehensive evaluation starting with a blood test for anemia, thrombocytopenia, and leukopenia, followed with extensive testing such as bone marrow aspirate, biopsy, flow cytometry, immunophenotyping, and genetic analysis. Hypercellular marrow with abundant blasts is often revealed in a bone marrow aspirate and biopsy confirming AML. Flow cytometry categorizes leukemia cells based on surface proteins with CD13 and CD33 being common markers on AML blasts. Additional diagnostic tests may include metabolic panel testing, liver function assessment, serum lactic acid dehydrogenase, uric acid levels, and human leukocyte antigen typing for transplant candidates. Lumbar punctures or tomography scans may be required based on symptoms. Immunophenotyping is crucial to distinguish between healthy and leukemic cells, and AML is confirmed when at least 20% myoblasts are present in bone marrow or peripheral blood. Cytogenetic and molecular studies aid in risk stratification. The 2016 World Health Organization AML diagnostic criteria specify that AML is diagnosed when peripheral blood or bone marrow contains at least 20% blast and fits certain criteria, which may include MDS history, multi-node dysplasia, or specific cytogenic abnormalities. Comprehensive diagnostic techniques involve patient history, clinical data, physical tests, imaging, and laboratory testing, including cytogenetic and genetic testing for specific aberrations, distinguishing AML from other leukemias. That's all from diagnosis. My friend will continue the presentation. Thank you.
Hello, my name is Uttami Uttami and my student number is 038, and today I will present to you about the staging of acute myeloid leukemia. There are two main classifications that have been used to determine AML subtype, that is the French, American, British or FAB system and World Health Organization system. The first one, the French, American, British system, classifies AML based on the cell type of leukemia that is involved and the maturity of the cells. FAB classification divides AML into few subtypes from M0 to M7, as shown on the slides. Meanwhile, the World Health Organization classification separates AML into a few categories, as shown on the slides. That's all from me. Thank you.
Hello everyone, my name is Ana Agusaguraningsuma and the last 3 digits of my student ID number is 181. I will explain about the differential diagnosis of acute myeloid leukemia. The first one is acute lymphoblastic leukemia, which is a common malignancy in children, and it is characterized by uncontrolled production of abnormal lymphocytes and leading to replacement of bone marrow normal hematopoietic cells, which results in lower red blood cells, thrombocytes, and neutrophils. The second one is aplastic anemia, which is a syndrome of injury in the bone marrow, leading to a decrease of hematopoietic precursors, resulting in empty or aplastic bone marrow. The third one is myelodysplastic syndrome, or MDS, also known as myelodysplasia, is a clonal disorder which is caused by overgrowth of abnormal hematopoietic stem cells, further causing ineffective blood cell component formation in the bone marrow. The fourth one is primary myelofibrosis, which is a type of myeloproliferative neoplasm along with polycythemia vera and essential thrombocytopenia, which is often accompanied by GAK2 or CALR gene mutations. That's all from me. Thank you.
Pururaswini Astawa and my last digit number is 161. There are two main treatments. They are induction therapy and consolidation therapy. For the induction therapy, this induction therapy has the main goal, that is to induce remission. However, induction therapy still has a weakness such as toxicity to the bone marrow is very high and causes organ function replication. For the consolidation therapy, this therapy is carried out after complete remission is assigned. Consolidation therapy begins with the administration of high doses of therapy under the uninhibited and hematopoietic cell transplantation (HCT). Consolidation therapy aims to prevent recurrence and eliminate risk. Thank you.
Please let me introduce myself. My name is Julyvia Gifensius with the last 3-digit registration number 088. I will now explain about the prognosis of acute myeloblastic leukemia. There are two possible outcomes. Patients may either achieve complete remission or recurrence. After receiving treatment, over 50% of patients with acute myeloblastic leukemia experience total remission. As partial remission does not significantly improve survival, treatment should be sufficiently aggressive to achieve complete remission. The prognostic factors include genetic mutation and chromosomal abnormalities. Older age, a white blood cell count above 100,000 at the time of diagnosis, secondary AML, therapy-related AML, and the presence of leukemic cells in the central nervous system have all been linked to worse outcomes in patients with acute myeloid leukemia. That's all from me. Thank you.
This is the conclusion of this little project. Acute myeloid leukemia, or AML, is a blood cancer which its malignancy originated from a stem cell progenitor of the myeloid lineage. It is resulted from genetic abnormalities that causes neoplastic alterations and clonal growth just as other cancers. Although AML is still a rare cancer, it is discovered to be common in youngsters with a 30 to 40% frequency. The etiologic factors of AML are quite diverse, ranging from gene mutations to chromosomal changes, with translocation being the most common. Some genetic conditions such as Down syndrome, etc., may increase the risk of developing AML in childhood and adolescence. The pathophysiology of AML is a maturity block or halt of the maturation process, which stops the differentiation and production of myeloid cells in immature cells. Primary symptoms of AML is the main manifestation of signs related to bone marrow failures and anemia. Complications associated with AML and its treatment includes infectious complication, febrile neutropenia, and etc. The diagnosis involves complete blood count, a bone marrow aspirate and biopsy, and various assays such as flow cytometry and etc. Two main classifications has been used to determine our subtype: the French-American-British system and the WHO system. A range of other hematologic malignancies are included in the differential diagnosis of AML, such as acute lymphoid leukemia, aplastic anemia, and etc. The standard type of chemotherapy used to treat AML is induction therapy, and recurrence that occur can be prevented by carrying out consolidation therapy. There are two possible outcomes in making acute myeloid leukemia prognosis. Patients may achieve complete remissions or recurrence. That's all from me. Next slide. Here are the list of references that we have gathered in order to make this student project. Next slide. That is all from the presentation of this student project. We hope that the viewers can gain a lot of new knowledge and insights about this student project. We are sorry if we had said something wrong, and thank you for listening.